New York's death toll from coronavirus rising to nearly 11,000 after New York City officials recalculated figures to include probable victims who were never tested. But Governor Andrew Cuomo says the worst is over for the state as the number of hospitalizations is remaining stable. Dr. Anthony Fauci echoing that sentiment in a new interview this morning.
Given what we are doing, the worst looks like, for the most part, with a couple of exceptions, there's still a couple of cities right now, Savannah, that we're worried about that haven't yet peaked and turned around. But if you look at the New York metropolitan area as kind of the prototype that's been driving this through the country, and then look at the country as a whole, there's no doubt what we've seen over the last several days is a flattening out, and even when you get to New York, it's actually starting to come down.
Coming down right here in New York, that's where we find David Lee Miller. He is live again in New York City. Good morning, David Lee.
Good morning, Ed. The impact of the coronavirus on New York City appears now to be much more devastating than had been previously realized. The city health department, which calculates confirmed deaths from the virus, is now releasing presumed deaths as well. The numbers are staggering. In addition to 6,589 lives lost, another 3,778 are thought to have died from the disease. The majority of presumed deaths took place in hospitals. Moments ago, on Fox and Friends, Mayor Bill de Blasio explained the reasoning behind the deadly calculation.
We just wanted this larger truth to come out, even though it is not 100% confirmed, and I want to be really clear about that. It is probable, and it's important to say that.
New York City, meanwhile, will become more self-reliant. The mayor says city businesses will increase production of personal protection equipment, making more than 400,000 face masks and 100,000 surgical gowns a week. Subways, trains, and buses have continued to operate during the crisis here, but at a price. The virus has claimed the lives of at least 59 New York area transit workers. Now families of those who died will receive 10 times the normal death benefit, $500,000. The head of the Transit Authority calls frontline workers heroic. And starting today, the general public for the first time can take a coronavirus test using saliva. A test developed by Rutgers University is available to local residents at a drive-through facility in Edison, New Jersey. But plans are being discussed with the White House to expand that test across the country. And as we have said time over, this New York City is the epicenter of the virus. Thousands here have lost their lives. One of them who has not died, Janet Mendez. She's 33 years old. She spent 3 weeks in Mount Sinai Hospital, 10 days on a ventilator. She is now recovering at her home. Her recovery is inspirational for the city and for the country at a time when people desperately need to believe that anything is possible.
Yep, we need more and more of those stories. David Lee Miller, thank you.